Hi, everyone. After all these months of working from home, you would think that we had this Zoom thing down, but I don't. I'm always on mute. That should be my name. You're on mute, Angela. Anyway, thank you for inviting me to participate in this panel. Thank you to PAI. Thank you, Nabiha. So basically, we're here to talk about locally led advocacy and the power of locally led advocacy with respect to SRHR and the achievements of some of these organizations, these amazing organizations that I'm about to introduce you to, and basically the road ahead, right? Recognizing that we're living in complex times, and also that SRHR has always had its own difficulties, especially when it comes when politics is a part of the discussion. And so we want to talk with with our esteemed guest this morning about the work that they've been doing, and also about talk about some of our challenges, but really and truly, what does the road ahead look like for us, right? So without further ado, I would like to ask the three. There's Mr. Muwonge he's the founder and executive director of Samasha in Uganda. Giselle Scanlon, president and CEO of Insalud in the Dominican Republic. And of course, the executive director of SERAC in Bangladesh. Hi, Giselle. Hi, hello. I just don't want to mispronounce any names.
Hello.
So I want to let people tell me how to say it appropriately. And
it is all fine, Angela.
Hi. And I'm looking for Moses. Is he? I'm not seeing his picture. Is it because I don't have all the screens up? I don't know. I'm gonna allow us to.
Yeah. I'm not seeing Moses either. And
okay, I thought it was me. Yeah. I thought because I didn't have all
I think he just got dropped. Moses is joining us from Ethiopia. So you might want to just continue with Giselle and Shaikat and go from there.
Absolutely. One of the things I've learned about working in these times is to have grace and to offer grace to everyone all the time. Internet and all the things that we have to deal with. So without further ado, I'd like to let's jump right on in. Yeah. Could you both start with Giselle, if you don't mind? You could tell us a little bit about your organization and about the mission, your advocacy priorities, and what does it look like for us to move forward? And I just want to say, I'm a moderator that keeps the time, so we're just to make sure that we're running our ship on time, right? So everyone has about 2 or 3 minutes to kind of take this sort of overview. Okay, so let's get started. Giselle, I'd love to hear more about the organization.
Thank you very much for giving me the opportunity to share with you a little bit about our organization. We're a network of more than 70 NGOs that are committed to advancing social and health reform through dialogue, advocacy, and the promotion of strategic alliances between the public and private sectors, and of course, member organizations of Insalud, as well as pursuing the institutional strengthening and sustainability. I would like to tell you a little bit about what we have been doing with PAI, I'm sorry, we call it PAI. It's just a short summary of the initiatives that we have forwarded to access contraceptives in the Dominican Republic. And this has been all carried out with the support of PAI. It's important to give you a little bit of information about the Dominican Republic for those who do not know. We are an island in the Caribbean Sea, and we share the island with Haiti. Right now, we have a population of 10.6 million, and we still have a poverty level of about 23%. Now, Dominican Republic has one of the biggest problems that Dominican Republic faces in the health sector is the very high maternal and infantile mortality. We are in the region, we are the third maybe even the second highest mortality rate of Latin America and the Caribbean, as well as the second highest teenage pregnancy rates of the region. So these are very big problems. And that's why the issue of contraceptives, of family planning, and sexual and reproductive rights is so important in our country. Therefore, in 2018, we were provided with the possibility to work with PAI on improving the management of availability of contraceptive supplies for the greater access of Dominican Republic's women and girls. And we also, of course, access to safe and continued contraceptive is the cornerstone of this support. In 2018, the party argued that for the efficiency and the sustainability, its interventions needed to be evidence-based and solidly anchored in the DR health sector reform. Therefore, a baseline study confirmed the problem of access to reproductive health services and supplies, among other things, for the lack of the norms and the procedures followed by the Ministry of Health. On this basis, the project proposed 4 interventions whose sequential implementation would improve the access to reproductive health services. One was to integrate the supply of contraceptives to one single system of medical supplies that already worked in the Dominican Republic, to develop a programmatic supervision system that would allow to verify and reinforce compliance in health establishments with the standards and the procedures issued by the Ministry of Health. Develop a model to stimulate demand, and this was very important. Now with the COVID pandemic, we had a problem of people not going to get their supplies, and so it was very important that we stimulate the demand through the project. We did also to develop information system on the productivity of the establishments. Sustained support from PAI from 2018 has enabled the implementation of these interventions. The Dominican Republic now has a regular system for supplying contraceptive methods to health facilities, which has improved their availability and consequently the number of protected couples. We were able to provide a supervision system for the use of the Ministry of Health, a demonstrative model that stimulated demand also to improve the influx of users to family planning services in the health establishments. We now can ensure in 2022 that the first 2 interventions, which means the provision of contraceptive methods and programmatic supervision, are entirely sustainable. That is, they have been incorporated into the operational routines of public institutions and operate with no need of additional resource. Furthermore, programmatic supervision has been adopted by the Ministry of Health, and we've even been able to help with the supervision of the adolescent and infant services. Finally, with the support,
You're about to say finally, go ahead.
Finally, with the support of PAI, the demand stimulation model is now being systemized and transferred to operational guidelines for the institutionalization of the Ministry of Health. The success of these interventions has depended on the sustained support of PAI, since these are not possible to achieve in the short term. The early involvement of authorities and technicians from the public institution in the design and implementation has formalized good practices and regular regulations and procedures. We have been blessed with the fact that the staff that were our liaison with PAI for the last 4 years have provided us with invaluable know-how, guidance, and support. We will be eternally indebted to them. PAI is currently supporting the institutional strengthening of the described intervention and an information system to produce its services. We have very
Giselle, hi, Giselle, I have to ask you just to hold on to a little bit. We're going to talk a little bit more about what your organization is doing.
No, I'm finishing.
Yeah. Just want to pay attention to the time.
We'll keep you informed, but we think we have progressed quite a bit, and with the help of PAI. Thank you.
Thank you. Tell me how to pronounce that. Is it your name? Shaikat?
Yes, absolutely.
I just want to make sure. Please, you're up. I'd love to hear about your organization.
Okay, thank you so much. And I'm so glad to be here and invited by PI on its 2025 vision launch. I work with SERAC Bangladesh as the executive director, and the SERAC has been a long-standing partner with PI. I'm so proud that it is rethinking strategies, and it's a new beginning of an era that will support partners and advocacy strategies around the world in SRH and family planning. So I just briefly want to recap on how we started the partnership, and that was back in 2018, the late 2018. We started the official partnership with PEI, and that is still continuing. And with this support, our advocacy asked for extension of the service hour of the adolescent-friendly health centers across the country. There are 1,153 adolescent-friendly health centers run by the government. So the advocacy ask was to extend the service hour of those centers, because the center service hours wasn't until from 9 to 2 p.m. But then the schools of the young people, school hours were not friendly. The service hours were not friendly with the young people to access them. So we were on this move, but then the PI came to support us. And I remember that it was back in 2019 that we received the official confirmation from the Ministry of Health as a result of this advocacy, that the service hours was extended for 1.5 hours back in 2019. I really thank Population Action International for their for believing in us for that very short time and very a very intense advocacy drive. But we actually didn't stop. We revisited our strategies. The SERAC team was we received facilitations from PI to start the second drive for another extension of 1.5 hours. It's like that was very much like a wild idea that time for policymakers to just, we already have one extension, then we went for the second one, but it was to meet the demand of the adolescents and young people of the country. So I can connect the 1/3 of the country's population are young people under 30. So it's like very much of their demand to be met. So after a series of events and human chains, I remember I again say that it's human chains, policy influencing, meetups and consultations, reality checks. Those were done by young people of the country. And in November 2021, last year, after all this COVID and everything, on a very high level meeting at the national level, where the health secretary, director general, and all the line directors of the directors general of family planning unitedly decided to accept this another extension. And so the ministry will extend these hours in the selected facilities where providers are available for 24. So it's like very much like this another innovation. It's like very much supported the country's advocacy, country's policy landscape change around adolescent youth health services. So it's like, so PI and SERAC Bangladesh joined hands together to take this initiative, and I can recognize this partnership because the government is recognizing. I just recalling the day before yesterday when the Director General herself, she said that the SERAC with its advocacy is supporting the ministry and everyone. So it's like, so how we did that, we of course recognize this support. And I just wanted to share, if the time allows me, that there is another innovation that my organization is leading, which is the Bangladesh National Youth Conference on Family Planning that we initiated in 2016 to create a sustainable platform for young people to generate and account for commitments on SRH and family planning in Bangladesh. Till now, ministers, MPs, heads of departments, NGOs, CSOs, and everyone, and thousands of young people everywhere, from everywhere in the country, they joined this annual event. And it has become a sustainable advocacy space. And I believe that all these initiatives, organizations like PI joined us and other partners, because SERAC Bangladesh has been leading young people's demands at the advocacy space for a long time. But the advocacy activities are rarely receive such support that is called flexible funding. So I believe the flexible funding like that of PI's UXS project is a great support for for organizations like young people and youth-focused organizations to bring in change. And SERAC set an example for that. When you believe in the partnership, advocacy is a weapon to change and creates collaborations beyond just the funding. So that's all. And if I get a chance again, I'll explain something more. Thank you. Angela, over to you.
Thank you. I was about to say, I'm on mute. I'm looking for Moses. I haven't seen him. Has he joined? Is he having still internet issues?
Yes, Angela, he still is. So
Okay,
it'll be
okay.
Giselle and Shaikat.
Okay. Giselle, I have a question I'd like to ask you. Can you talk to us a little bit about, is it Accesso, the Accesso program, and the advocacy approach that Insalud has taken with improving access to a range of SRH services?
Yes, I think I explained many of the aspects of this program right now. But one of the main points I want to really point out is how we have been able to advocate with the government, with the Ministry of Health, and that they incorporated these methodology, the way that we taught them how to supervise the different programs, especially a family planning program. And that has been very important for the advancement, especially in this moment where we have still a lot of the effects of COVID. The pandemic brought us a lot of unwanted pregnancies, and women did not even want to go to the different services because they were scared to get infected. That way it was a big problem. And I think that globally we have the problem of unwanted pregnancy and many abortions to that because of this. But fortunately with PAI's of support, we have been able to advocate with the government, and the government is working together with the civil society on issues that have to do with the reproductive and health rights. So that has been pivotal for our advancement. No?
Thank you. I noticed Moses may have joined. Hi, Moses. Hi, I'm Angela. Are you able to, your internet, it's good now, we can jump right in and get some information about your organization, and then we can ask you some other questions.
Thank you so much. I apologize.
No worries.
I'm in a hotel, so internet is up and down, so I'm now in the lobby.
Yeah.
But I'm glad to be here. This is a PAI way of doing things. Samasha is a civil society organization that is based in Uganda, Kampala. And we pride in doing advocacy and accountability, health system strengthening, and innovative thinking, focusing on maternal child health and family planning. We deliver our work through technical assistance. We build capacity to civil society organizations. I can see you are straining to hear me. Can you hear me very well?
No, I can hear you perfectly fine.
Okay, yeah, so we deliver this through technical assistance, building capacity, and we've been so glad to associate with PAI. Thank you so much.
Okay. Well, since you just got here, I'm gonna just pick on you. So I have a question about, you said that, that your organization works on building accountability but tell us about what do you think the role of local civil society has had in advancing family planning and accountability and commitments, and about how has your government reacted to the way the CSOs in Uganda have engaged on this issue?
Thank you so much. When you talk of commitments, advocacy, and accountability, we always taken the definition of accountability literally, because it means holding power holders to account. But over time, the power holders are getting fatigued. All the time we are their doorsteps trying to make them account. So the question is always, but civil society organizations on your side, what are you doing? And so Samasha believes in advocacy in partnerships, and that is mutual accountability. In terms of the commitments, when governments make commitments, they always make these commitments on behalf of everyone in that country, including civil society organization, development partners. And that's a concept that Samasha believes in, and it's where civil society should be thinking to be, because as civil society, we must show our value before we start holding others accountable. And that value should be within our capacity to understand situations, our capacity to analyze policy gaps, advocacy gaps, and our capacity to work in partnership with the governments to realize the results we need. I want to say that civil society organizations were in different areas, but we should not be like the lobbyists. We should not be like the street demonstrators. We are partners with the government. Thank you.
And just a follow up before I go to Shaikat, I just want to know, how has the government responded to that approach? Has it been mostly positive? What was that? What's the response?
I'll give you an example. When you are implementing the motion track project in Nigeria, the director in Nigeria had really sort of been called to this idea of accountability for commitments. But when I went to his office and I looked in his face and said, look, we are coming here to work in partnership. We are going to make sure that civil society show you what they are doing, and then you also show us what you're doing. We are going to work in partnership. The man woke up and shook my hand and said, now this is what government wants. Let's work in partnership. We are tired of finger pointing. So that shows the reaction that government looks at in terms of that.
Thank you. Thank you. I want to know, Shaikat, I'm back to you. As a youth-led and youth-focused civil society organization, can you, I mean, you got to talking about the youth voice when you first started, and you talked about the youth conference, I think you call it the youth conference.
Yes.
You know, so what has been sort of the result of that with respect to SRHR in Bangladesh?
Thank you so much, Angela. I think the first response would be, if you Google SRHR in Bangladesh, you will find SERAC Bangladesh. That's the first response. And the second thing is, if you go to the Director General of Family Planning and you ask about young people and SRHR and family planning, they will also send you the Google reply, SERAC Bangladesh. It's because the Director General and the Ministry Secretary on the 25th of April, they just together, they were on the call and on the meeting, they mentioned that SERAC is our own organization. So when a civil society organization becomes the ministry's and the government's own organization, is because we build the trust, and the trust building process was totally supported by partners like PI. So it's like a series of events and meetings, and we proved it to them that we are trustworthy, and young people youth organizations can be valuable partners to the government, and it can make changes. So we have proved it. The National Youth Conference has become a very sustainable and very participatory space for the government, NGOs, the donors, and academicians and young people. So it's like this is the one of a kind space in the country. This annually, it holds all the stakeholders together to take action, account on their commitments that they made the year before. So I just recall that there are a lot of commitments that the Director Generals and the directors made in the past years that were accounted in the next year by the same participants or the other ones. And this is the process. It supported the government and the policy landscape in the country. I just can relate to the last year's 2021's hybrid model Bangladesh National Youth Conference, where the Minister of Health joined as the chief guest, and also all the directors. So it became kind of a custom that the ministers will be on the panel and all the Director General will chair the sessions. So it's no more like the SERAC event, it became the national event, and all the governments making it their own. So when this kind of a platform gives all the organizations that are working in the country, no matter their youth organizations or adult-led, so whoever working as a teacher can come and join the conference and ask the question and place their and showcase their advocacy advocacy force in the conference that are connected to young people and adolescents. Currently, what I can say that out of this kind of an event, there are policy recommendations that resulted in national level changes, like including youth in adolescent-friendly service centers, which never happened before this kind of an initiative. So last year, with the support from USAID, we also deployed 40 young volunteers in government-run adolescent-friendly health centers in 4 districts in the country. So this became a pilot, and 25th of April this year. So the government has decided the pilot is resulting very well, and now what we can do is we can look at the results and scale up. So the commitments was, so the advocacy was during the conference and other processes. The commitments was made during the conference, and then the proposal was accepted by the Director General, and then it happened, and now they're wanting to scaling up. So it's like very much a series of this kind of a process, and I think organizations like PI are really key to support this kind of. If you allow me 30 more seconds, I can just say, as the Executive Director of SERAC, I can clearly relate how it has been preparing the Population Action International has been preparing his Vision 2025 goals. When I was looking at the first slides, I was relating to the commitment, because it stood by the partners even in difficult hours like COVID-19, and it continues support like throughout the COVID lockdown. So I remember that the PI was the one that came to us and sent additional funding during COVID lockdown. That was the commitment. It supported the access that I mentioned, that the young people are accessing family planning and SERAC in the country. And to stand by the movement of young people, remember that in the advocacy spaces, it's very rare that the organizations come with funding to support human change on the streets, but it did. It believed that the human change would result. So human change made news, and the news influenced the policy landscape in the country. So so this is the point why we stand firmly with this vision, and with such a number, with these number of logical reasons we have. And thank you, Angela, for giving me the chance to speak on that. Thank you.
No problem. Thank you. So we're going to talk a little bit more about this. So currently in international development, in our spaces, we've been talking a lot about localization, right? This idea that it's a concept that all of a sudden, we think that local people in these countries know what's best for them. Wow, what a concept. So now I want to have you all sort of help me to engage on what localization actually means in your own context. So let me just give you a little bit of context. PAI has about 120 CSO partners in 36 countries. Over 90% of them are local, indigenous organizations. And that at PAI, they've always prioritized the collaboration with local community organizations in supporting SRHR goals. So now we're focusing on localization. As these strategies unfold, what do you think needs to be done in regard to the localization strategies that donors and others are now building so that local organizations can further their impact? I'm gonna start with Giselle. Given, this, you hear all these organizations, big donors talking about localization, locally led advocacy. But we know when we work in these countries that people with proximity to the issue know what they need to be done, right? We know proximity matters. So how has Insalud sort of, as a local organization, like what has been your sort of, your approach to understanding some of these big strategies that these donors want us to advance with respect to localization? How have you all handled it?
Definitely, we believe that this localization is really something that could really contribute to helping local organizations build with the government, because it's very important to know that if we don't have the government involved, especially in terms of health issues and delivery of these health issues, you're not going to be able to get too far. It's very important that everybody is on the same page, but at the same time, we share different technologies, different approaches that are innovative to the government organizations, which most of the time are they're very backlogged with different, they don't work very well with new things, with novelties. So I think it's very important that, first of all, Insalud is an organization which is a network of more than 70 organizations. For us, it has been very important to be able to work with the other organizations in issues. For example, the abortion, the right to abortion in 3 causes, for example, which is something that we have been pushing for years from the women's organizations. And those are things that we have to work with Congress, we have to work with the different institutions to create awareness, etc. So it's very important for us to be able to receive the funding so that we can work with governments to change these policies, to create awareness, etc.
Thank you. I heard we're running out of time, but I have to ask Moses about localization, and then Shaikat, you get the last word. So Nabiha, give me 2 more minutes, please. I wanted to be better at this, at the timing, but this is an important topic. So
you're great. Go for it.
2
No
minutes
problem.
worth of grace. Thank you.
Thank you, Angela, for
Moses, go ahead.
defending us and giving us more time. One thing I want to say is that localization, if you want to talk about localization, PAI started the localization long time ago. Most of the international organizations, when they are coming to the developed world, the global south, they look for these organizations that have 10 years of experience, 20 years of experience. Yet PAI, if you look at the profile of the PAI partners in Africa, in Uganda, Tanzania, in Zambia, they are mainly small local organizations that were not really like 10, 15 years old, but that had potential. And PAI got those organizations, including Samasha, where we are. PAI built our capacity in advocacy and accountability. So I believe localization, in terms of the vision for PAI, was long time ago. What I think now PAI needs to do in order to entrench localization is now to focus more onto the sustainability of these local organizations. And I think that's when you talk to Nabia, she's really thinking about how can we make this more sustainable. We've been working with you for many years. How can it be more sustainable? So I'm happy with the strategic launch because it looks at that aspect of our civil society organization, the Global South.
Thank you, Moses. Shaikat, you get the last word on this localization conversation.
Thank you so much. I'm going to relate this to the SDGs because the concept of the Sustainable Development Goals is to making them work for local initiatives. And it is a key to achieving them as well, especially when we are meaning gender equality and health. It is not, I believe it is not possible to achieve global gender-related targets without making change to the disparities at local levels. So it is very important that we consider localization of each of the efforts and strategies that the organizations are taking anywhere in the world. I also can give an example about the healthcare, where how localization is very, very important to that. Imagine a young person in low-resource setup failing to access healthcare and family planning services is actually failing the global index of health and population achievements. So it is really crucial to invest locally to generate sustainable solutions, and those can last beyond just the SDGs and other targets. So as a leader of the local organization, I feel that when you frame greater global strategies, open and flexible engagement processes to your strategy, this is going to benefit us all, to the local organizations, local communities, and as well as the global leaders who are actually dreaming to make some changes around SDGs and other goals. Thank you so much, Angela.
Thank you. So I'm just only 4 minutes over, Nabiha. So I think that was okay. I want to thank you all. for your participation. And I also wanted to direct you to the chat because it looks as though there are some questions that's coming up in the chat that are addressing you all individually. And with that, Nabiha, I turn it back over to you. Thank you for this opportunity to meet you all and to talk about this.
Thank you.